My name is Deb Van Dyke and I'm a nurse practitioner at UnityPoint Health. For a long time, patients didn't know there was a difference and they would call me doctor, and I'm not a physician. I am a doctor of nursing practice, but we just call me Deb in the clinic. So if patients ever have a question about it, I'll explain the difference between an MD and an NP, education, what we can and can't do, and most of it, 90% of it is the same. I came to the University of Northern Iowa to be a teacher and did not love that. And while I was here, I had a health scare, and there was a really awesome nurse practitioner that really walked me through that, treated me with respect, was very kind, gracious. You know, sometimes if you're a teenager, people think you're a little histrionic, but she was just very kind, and I wanted to be that person for someone. So I went to Allen College and did a BSN program, worked as a nurse for a year, and then did their master's program. I worked as an ER nurse practitioner for about 3 years, and then came to diabetes and endocrinology, and I've been here almost 17 years. Day to day, come in, start seeing patients. I usually see around 20 or so patients a day. I do collaborate a lot with other healthcare providers. Just this week, there was a patient that needed something from their primary care provider who happened to be down the hall, so I just went down and talked to them. They came down and they handled the concern. What they really care about is that I care. I think they want to be listened to. They want their questions and concerns to be managed in a respectful manner, and I really just think that that's all that patients want. We have wonderful physicians. So in our clinic, we have one physician, 4 nurse practitioners. So we try to be able to see patients on the same day, because if you have a problem with your blood sugars, you want it to be handled right then. So we really provide that access. We're just able to take care of more patients with fewer physicians.